seeing things. One of the studies, one of the guys who presented at that conference in Minnesota went back, and he eventually, we got calls from Sam Snead heard about this, and I guess there are people here who are young enough to not even know who he was, but he was one of the original golfers, one of the original pros, and he ended up flying to South Dakota because it was closer to where he lived in West Virginia than to come out to see me in California. But he, after very few treatments, went from 2100 to 2030. In his, I believe it was his right eye, his left eye, they had basically burnt to a crisp with a laser, so he never really got vision back in that. But he got enough vision back, he was able to drive again, and he'd been off the senior tour for years, and he went back and started playing again for a few years before he died. And he was actually going to open the Sam Snead Centers for Eye Disease Treatment. He had this whole plan to do this, but that never came to pass. But because of this, he was quite vocal about this, so there was a brief little flurry of press about this, which brought some public awareness, but it never has really caught on with the ophthalmologists. This is just data from my first 120 patients. 86% of them showed improvement of 2 lines or better. So that means if you're measuring acuity on a visual acuity chart, you have how many lines. Usually it's about 5 letters per line. The 2 lines, the reason 2 lines is important is that that's kind of a standard that's been developed, that less than 2 lines of improvement could be due to chance. All of our vision varies from day to day. If you've got a headache, if you've got sinus, you get a cold, your vision may take quite a drop. Stress can decrease your vision by 50%. That's work that the military's done, that was done at Stanford near me. And so it has to, there's a certain threshold you have to cross before you can say it's true. But it wasn't just 2 lines. What these numbers out here are number of eyes, which is, again, a kind of standard in ophthalmology research, because sometimes eyes don't respond equally, so you look at the change in the eyes. So we had 1 line better, 43 of the 167 eyes, 39 of 167 too, but 24 out of 167, 3 lines are better, 4 lines are better, 37. So some of these people had 7, 8 lines of improvement on their acuity. And that persisted. I had one man who I treated who was working at Sam's Club, the big warehouse box that Walmart has, and he knew that his vision was getting better because the aisles were numbered. It started at 0 and went down to 137 or something. I don't know, it was a monster store. And every day that he came in, he could read a number down a little further as he progressed, and so he was real excited. But it's not just function in vision. And this, again, this is one of the patients I treated with ARMD. Same thing as on that other, just a little, this shows you the numerical data, and then this is just the way it gets graphically displayed. This is him after about 6 months of treatment. And it's interesting, his, you say, well, what did your ophthalmologist say about this? Because these diseases are never supposed to get better. This is never supposed to happen. And so the ophthalmologist, he said, well, he would keep going in, he would keep getting this study, and it would keep getting better. And the only comment that his ophthalmologist was that the damn machine must be broken again, because that was the only way that he could come to explain this.